Hello and welcome. Today is the start of a new show, Healthy Living with Dr. Richard Betts. That's me. I will be presenting health information every first and third Friday morning at this time. I always give a disclaimer at the beginning of the program. Any recommendations that I might recommend, make sure that you contact your healthcare provider and discuss any changes you would like to make before you implement anything I may recommend. The show is going to discuss health pointers and new research along with recommendations. There's going to be information you may or may not know. All of the information I present will always be backed by research, and this is extremely important because many of our outlets like Dr. Google, and I use that very tongue-in-cheek, Dr. Google and Nurse Facebook oftentimes have information that is not very well researched. So let's go ahead and get started with today's show. The subject matter is going to be discussing the importance of vitamin D and how it affects our health. So it is important that every single person get their vitamin D blood levels checked. Now, your doctor should be checking your vitamin D level regularly. If they are not, you should be demanding, not requesting. Notice I use the word demanding because it's so important. And the levels should be checked regularly. Demand will emphasize your understanding of the importance of having it done. Always remember, you are the only advocate for you when it comes to your health care. If you have a spouse or significant other, they can certainly advocate for you when you are unable to, but ultimately you must always advocate for yourself. Do not think the doctor knows best, especially when it comes to nutrient deficiencies. And vitamin D can be one of those, and oftentimes in many people it is a significant deficiency. Unless the doctor has had outside of their school training on nutrition, they do not know the importance of nutrition, believe it or not. There are only a few medical schools that teach nutrition as part of the curriculum, and those schools often require the doctor to get 3 credit hours of nutrition. That is extremely low. This is not even close to enough education to understand the importance of vitamins and minerals required to sustain health. I personally have over 4,000 hours of nutritional education. I also teach other doctors about nutrition on a regular basis. In fact, this last weekend, starting on Thursday morning until Sunday late afternoon, I was up in front of a group of 3,000 doctors teaching them about nutrition. At my office, my patients can get a vitamin D blood test for $45 cash, no need for a diagnosis or the insurer telling the doctor whether or not he can do or she can do the test. Now, this is important because oftentimes vitamin D doesn't get done unless there are several symptoms and you are diagnosed with certain things. And so then the doctor will be prompted to do a vitamin D test. So unfortunately, doctors who deal with insurers often have to give a diagnosis in order to order blood tests. A person can actually have a very low vitamin D deficiency for a long period of time before any negative symptom appears. Now, I'm going to talk a little bit about the reasons for vitamin D. So, number one, it helps in creating healthy bones. Understand that low vitamin D, no matter how much calcium you take in, your bones will continue to degrade into something called osteopenia and osteoporosis. Now, vitamin D, interestingly, regulates many cellular functions in the trillions of cells that your body is made of. Now, most of us have heard that in order for us to have hard bones, we need to have a certain amount of calcium. In the last, I would say, 2 decades, we also know that it's important, and we've been taught that it's important to have good vitamin D.
However, something that has not been readily available to us is that vitamin D is extremely important in many cellular functions. And we have trillions and trillions of cells that require vitamin D. Now remember, once you use vitamin D, it's no longer there. And so we have to make sure that we continuously get or make vitamin D. And I'll talk a little bit about that later on in the program. Vitamin D is, get this, an anti-inflammatory. So let me explain a little bit about inflammation. Many of us have probably heard about inflammation. In fact, it's in the regular news on a regular basis. You know, inflammation is the precursor to many disease states. In my mind, it's not that the inflammation is the problem as much as deficiency of certain nutrients and vitamins and minerals are the problem that cause inflammation and then cause the diagnosed diseases. Now, as far as the two major organs that we have to be very careful of creating inflammation in are the heart and brain vessels. Unfortunately, one of the structures in the body that actually has an increase in inflammation first are the blood vessels, so your arteries and veins. And what do the arteries and veins do? They carry blood from point A to point B. We carry oxygenated blood and oxygen to the cells through the arteries, and then we carry deoxygenated blood or carbon dioxide from the cells to the lungs so that we breathe that carbon dioxide out. Now, vitamin D, well, actually, let me talk a little bit more about the inflammation. So oftentimes what will happen is that the inflammation of the vessel walls get to a point that the space between each cell increases, and we don't want that to happen, because when it happens, there is a possibility of a leakage. And what I mean by leakage, it bleeds into the tissue. And of course, we want to make sure that we don't bleed into the heart tissue, and we don't want to bleed into the brain tissue. If we bleed into the heart tissue, it's called a heart attack or a myocardial infarction. If we bleed into the brain, it's a stroke. Neither one of those have a very positive outcome. So vitamin D is an antioxidant as well, which is a very helpful in decreasing cellular damage. Cells have an expiration date like our packaged foods. If a cell has increased oxidation that damages it, it will need to be taken out of use prior to its expiration date. So we want to make sure that we have foods and or vitamins and minerals that create a removal of oxidation. And that's what antioxidants do, because oxidation to the cells actually create more damage, and the length of time that the cell is going to be available to function properly decreases. Now, vitamin D has, everyone should understand this, it has neuroprotective properties. Now, in my clinic, I see a lot of patients with neuropathy. When I test vitamin D, I find that it is very low in patients suffering with neuropathy. I supplement vitamin D, which helps the nerves heal. I also use scientifically researched medical acupuncture, microcurrent, and nutrition to overcome neuropathy. These treatments combined help heal the nerves, removing the horrible neuropathy symptoms. Now, one of the things that I'd like to share with those individuals who might be experiencing neuropathy is that, unfortunately, the medical profession as a whole the primary thing that they reach out to is going to be things like gabapentin or Lyrica. Now, gabapentin is actually an anti-seizure drug, and Lyrica is a painkiller. Oftentimes, when patients come to me for neuropathy, they end up giving me information and basically telling me that they have tried those particular drugs and it may take it down minimally, but they also feel very loopy, or their mind is weird, or they have different odd sensations. So in my office, we actually look at the problem and define what is the reason for the neuropathy. And when you start taking away the reason for the neuropathy, believe it or not, the nerves heal. I share with my patients on a regular basis, as long as we create the environment that the body needs and give the body the building blocks that it needs, it will heal itself, period. As a doctor or any medical professional out there is not healing your body. They can't. Where the body heals itself is internally. We have an innate ability to heal ourselves. Now, a doctor may be able to decrease symptomology or make pain go away, those types of things, but really, we have to provide the body, once again, the right environment and the right nutrients in order for the body to heal itself. Now, vitamin D also supports another amazing system, and it's called the immune system. Most people who have a low vitamin D blood level are more susceptible to contracting different diseases. Now, research shows that vitamin D levels above 50 increase an individual's positive immune response toward killing bacteria, virus, and parasites that have infected the body. People who have vitamin D levels above 50 get sick less often. And unfortunately, for the last couple of years, we are going and have gone through this pandemic of COVID. And interestingly, when patients come into my office and I test their vitamin D level and they tell me, oh yeah, I've had COVID and I've had COVID more than once, I look at their vitamin D level and it is actually below 30. Now, that's the bottom of the reference range. So with the research that I have read and understand, the vitamin D level should be at 50 or above for the immune system to actually work like it was designed to work. So one of the primary things that I do is once I get those vitamin D test results back, I put the patient on a particular vitamin D that is extremely bioavailable. And very quickly, most of the vitamin D, unfortunately, over the counter is not very bioavailable, but I'll discuss that a little bit later on in the program. Now, the other thing that vitamin D supports is muscle function. If you are suffering from muscle strength issues, there's a good chance that your vitamin D levels are too low. Now, decreased grip strength is an indicator of low vitamin D level. So if you have problems opening up a jar, of peanut butter or something like that, or holding your coffee cup, that is a good indicator that you may have a vitamin D deficiency. Now, there are other nutrients that are important to have muscle strength as well, but a lot of research is really pointing to vitamin D deficiency creating that low strength. Vitamin D is also an excellent supportive nutrient to the brain. Now remember, I was talking about neuropathy in the earlier on in the program. Well, guess what? Vitamin D is really important to the brain and the health of the brain. If you are experiencing cognitive thought issues, most likely your vitamin D level is too low. Forgetting where you put the keys, walking into a room to get something and forgetting what you went to the room to get, or in the middle of talking about something and losing your train of thought, all are possible indicators of vitamin D deficiency. There are other nutrients that can be deficient, but vitamin D is one of those nutrients that can be most deficient. Now, there can be other issues going on with your cognition. For instance, like heavy metals. We do know that mercury and aluminum are two heavy metals that unfortunately, when we get it in our bodies, tend to go to what we call the substantia nigra of the brain. And this is where your cognition and your thought processes happen. And unfortunately, when we do things like get vaccinated, there are constituents of the vaccine, and a couple of those constituents can be, believe it or not, mercury, known as thimerosal, and aluminum. So if we are getting vaccines on a regular basis, we're adding to that heavy metal toxicity. Now, there are things that we can do to remove that heavy metal, and that's one of the other things that I also help patients do in my clinic. So, vitamin D, I'm going to talk a little bit about where it comes from, because vitamin D is not really naturally found in a lot of foods. Vitamin D is often found in fortified foods, such as milk and cereal. The vitamin D is a horrible synthetic version that is not readily absorbed. So what's sprayed, literally they spray this synthetic version of vitamin D into our milk and into the cereal. Now, interestingly, raw milk is an excellent source of vitamin D. Most people do not drink raw milk, as the United States has made this form of milk illegal in many states. However, there are a few states that you can purchase raw milk from the grocery store. I remember as a very young kid that the milkman would come and, get quarts of milk in these glass jars, and my grandmother and my mother had the milk box sitting out in front of the house. And the greatest thing that I enjoyed is, if you remember, raw milk, oftentimes what happens is that the fat solids do what? They float to the top. And I used to try to be the first one home after school so that I could eat all of that wonderful, good nutritional fat. A cream, or actually it wasn't even really a cream as much as it was the fat on the top. I loved that. I remember that as a kid. So grocery stores carry pasteurized or homogenized milk. Now, these processes destroy the naturally occurring vitamin D along with other vitamins and enzymes, making this milk more allergenic, causing gastrointestinal issues like milk intolerance. So further, this milk will rot quicker than raw milk, as once a bacteria are introduced, it takes very little time for the milk to get infested with bacteria. I have actually found that people are not milk intolerant, they are homogenized and pasteurized milk intolerant, because this milk is devoid of many original positive nutrients. Not only that, but when the milk comes out of the teat of the cow, there's actually good beneficial bacteria that actually help our GI tract as well. So by continuing to drink milk and eat it in other prepared foods, many people can develop GI issues like GERD, colitis, inflammation of the intestines, stomach, and intestinal ulcers, and the list goes on. And this is with, believe it or not, homogenized and the other versions of milk other than raw milk. Now let's talk a little bit about cereal. So cereal is fortified. This, if you are eating it, I would strongly encourage you to stop cold turkey, because it is a horrible choice for getting vitamin D or any other vitamin for that matter. Interestingly, the processing of the grain for the cereal and all of the vitamins are actually destroyed. The company will then spray man-made vitamins on the cereal toward the end of its final look. Do not let anyone tell you there is nutritional value in any cereal. Believe it or not, a lot of people think, oh, well, if it's organic, there's going to be a lot more nutrition. No, the processing happens the same. The original grain might be not using pesticides or herbicides, but for the processing, it is absolutely the same as regular cereal. So organic is not nutritionally sound either. Further, most cereal has copious amounts of added sugar. Now, added sugar wreaks havoc on your immune system. Sugar actually significantly decreases your immune system of doing its job for anywhere from, get this, 2 hours. Now, this is dose dependent. So if you're taking just a little bit, not even a quarter of a teaspoon, it can affect your immune system for 2 hours. If you take more, it can affect your immune system up to 72 or more hours. All of this is researched. So if you get exposed during that time where your immune system has decreased, exposed to a bacteria that you are getting maybe from the grocery store, someone in the grocery store might have a cold coming on and they're not quite doing the symptoms and they haven't sequestered themselves at home, or a virus. If you are walking around in an environment that might have bacteria or a viral load, there is a good possibility that your immune system is going to be so decreased that you're going to catch that cold or virus. So stay away, as far away from sugar as possible. And especially, I know that this is always hard during this period of time because we're getting into fall season. And it seems like when we get into fall season, starting a little bit before Halloween, I call it the sugar season. And the sugar season basically starts from a little bit before Halloween all the way to Mother's Day. So we're almost 4 or 5 months of where we add sugar to our diet that is not beneficial at all. One of the things that I find very interesting is I do not know how Cheerios gets by with advertising that their cereal is heart healthy. There is nothing about Cheerios that comes close to heart healthy. It is also disconcerting that the Heart Association advocates Cheerios being heart healthy. They are advertising as healthy heart products. In fact, I took this statement off the Cheerios website, and it reads, "A breakfast cereal you can feel good about. Each great tasting serving of original Cheerios is cholesterol free and delivers 1 gram of soluble fiber and 2.5 grams of total fat. Cheerios can help lower cholesterol as part of the heart-healthy diet. 3 grams of soluble fiber daily from whole grain oats foods like Cheerios cereal in a diet low in saturated fat and cholesterol may reduce the risk of heart disease." So the interesting thing is the label on the Cheerios box states the amount of sugar in the serving size of Cheerios is 2 grams of sugar. All cereal has added sugar, and if you are wanting to stay healthy, reduce your weight, and not have heart issues, do not eat any cereal, including Cheerios. According to research, men should eat less than 9 grams of sugar per day, and women should eat less than 6 grams of sugar per day. With one serving of Cheerios, a woman is consuming 33% of her intake of sugar right away in the morning, and a man is consuming 23% of his intake of sugar right away in the morning. Remember, one serving is 1.5 cups. Who eats that little of any cereal? Now, the interesting thing about Cheerios is the ingredients are stated in this manner on the Cheerios website. Ingredients, nutrition facts, and allergen statements can change. Always refer to the actual package for the most complete and accurate information. The interesting thing is that they don't even publish the ingredients on the website. You have to go and read a box of Cheerios to get this information. So the ingredients include whole grain oats, cornstarch, sugar, salt, tripotassium phosphate, vitamin E, calcium carbonate, iron, and zinc, AB vitamin, vitamin B6, vitamin A, vitamin B1, AB vitamin, vitamin B12, vitamin D3. Understanding how to read ingredients beginning of the list is very little. So in other words, at the beginning is where most of the ingredients says, that's the most mass, and then the low last ingredient is the least. So if you notice, vitamin D3 is the last on the list and therefore is negligible in vitamin D. Just remember, any food that is fortified with nutrients is man-made nutrients and horrible for the body. Another food that you can get vitamin D from is fatty fish, such as salmon, mackerel, and sardines. If you are going to consume these, make sure that they are wild caught. If they are farmed, they will be fed antibiotics, which you consume by eating the fish. These cause inflammation throughout your body and have many other negative effects on the body. If you would like to know what fish that are farmed, raised, look like while being raised, I would encourage you to Google documentaries on farm-raised fish. This is very sad and telling of what is being consumed if it is not wild caught. It will also show the illness that is rampant in the farm-raised fish. Now, your skin does make vitamin D. However, the production of vitamin D depends on many factors: the time of day, the sun exposure, the latitude in the skin, your skin pigmentation, and sunscreen. Now, sunscreen actually prevents vitamin D production due to not allowing the UVA and UVB rays to penetrate the skin. The UVA and UVB rays are important to vitamin D production. Unfortunately, older adults don't get regular exposure to sunlight and have trouble absorbing most vitamin D supplementation due to poor digestion, which is due to decreased nutrients in the food or decreased ability to absorb the vitamin D to years of nutrient deficiency, which causes the walls of the intestines to not be as permeable to absorbing nutrients. If you are taking a vitamin D supplement, most likely you are not absorbing most of what you are taking, and this is why symptoms due to vitamin D deficiency have not resolved. The form everyone should be taking is a emulsified form called calciferol. This is a thick liquid form, and when my patients take this form of vitamin D, their vitamin D blood level increases quite quickly. I prescribe vitamin D based on patients' symptoms and blood tests to give the body what it needs in order to heal itself. Now, understand that the research is out there, and the evidence of vitamin D is it decreases your risk of cancer. It decreases your cognitive health decline. It decreases your risk of getting multiple sclerosis, osteomalacia, arthritis, osteoporosis, and in small children, rickets. Interestingly, when I was practicing in Florida, every single person that came into my office was vitamin D deficient. As I said at the beginning of the program, you should have your vitamin D blood level looked at on a regular basis. It is important to have a high quality vitamin D. I use a car as an example. You can have a car that has 4 tires and one that only has 3 tires. The one with 4 tires is going to get you from point A to point B, but the one with 3 tires isn't going to get you anywhere. So vitamin D is extremely important for your health of your body. I'm out of time. If you are interested in getting more information, you can contact my office at 563-241-8760. Tune in on September 16th at 9 a.m. to listen to the next Healthy Living. Please continue to strive for healthy living.
You're listening to AM 13.